All right, welcome to step number 4, treatment options for your dog's ACL injury. Check out videos 1 through 3 to get caught up to this point, and then finally we'll have 5 and 6 coming your way with why would you treat an ACL injury with the TPLO, and some scientific evidence in step number 6 to support our decision-making process. All right, treatment options. Picture on the left is kind of indicative of rehabilitation for treatment, and picture on the right is kind of showing surgical treatment. This is the saw that's used for performing the TPLO. Okay, some people call it non-surgical management, some people call it conservative management. I think non-surgical management is a better term to describe how to treat your pet after an ACL injury. The reason why conservative isn't a great term for it is that because it can be quite involved. We've got a picture of a water treadmill, a wonderful tool for rehabilitation of injuries in dogs. We've got veterinary diets that are full of omega-3 fatty acids. We have glucosamine and chondroitin sulfate supplements here. Another glucosamine and chondroitin joint health supplement. We've got Adequan, which is an injection that helps increase the viscosity of the dog's joint fluid. And then finally here in terms of drugs are the anti-inflammatory drugs. When we talk about non-surgical management of the dog knee, we want to talk about in order of what you should be doing. And the last thing on that list is drugs. First thing on that list is weight loss. Okay, dogs that are overweight have been shown to be 4 times more likely to injure their ACL. And in another study that we'll talk about shortly, dogs that lost a significant amount of weight had a better chance at doing well without surgery. So weight loss is number 1. Slow, controlled, routine exercise is number 2. You want to make sure that if your dog has an ACL tear, you continue to, a partial tear that you're trying to rehab, you continue some mild activity. Now there may be a rest period of 2 to 4 weeks, but after that rest, some motion will be required to maintain muscle stamina. That motion should be low impact. It should be routine and regular. So there should be a routine to it so that we're building muscle stamina. It should be low impact so that we're not causing excessive joint injury. After that are the joint supplements, joint diets, and then as we said, lastly, drugs. All right, let's look at some science here. Short-term and long-term outcomes for overweight dogs with cranial cruciate ligament rupture treated surgically or non-surgically. Again, cranial cruciate ligament is synonymous with anterior cruciate ligament for all purposes. Okay, dogs in this study lost at least 10% of their body weight. That's critical because if you start just taking science and saying dogs do great without surgery for an ACL tear, you're missing the picture. These dogs all lost at least 10% of their body weight. If your dog is already in perfect body condition and it tears an ACL, it is less likely to do well than the dogs in this study. Okay, overweight dogs treated surgically had a better outcome than overweight dogs treated with non-surgical methods. Okay, so surgery can outperform non-surgical management, but both produced satisfactory results if the dogs lost weight. So we've already said that last point. Okay, let's take a look at an example here. Let's say this is your pet, 4 years old, doing great, otherwise super active and healthy, And a month ago, you might have seen a little misstep, maybe some limping in its right rear leg, right back leg. And so you kind of rested him for a couple days, him or her, and now you went to the park again, and she's been limping ever since. We're 2 days out, and she's limping really bad now on this back right leg. Otherwise normal. You go to your veterinarian. They do the direct or indirect drawer test to see if there's instability in the knee, and there is none. The knee is stable, okay? So the ligament is not completely torn. It's very likely an early partial tear, okay? So we're early on in this process, early partial tear. Now, this might be what the x-ray looks like that your veterinarian takes. We've got maybe some real early signs of arthritis, some early joint effusion or joint swelling, but all in all, the knee is very pretty. This is beautiful cartilage, nice joint surfaces, and the knee is not unstable. So you're combining both physical examination, checking for stability, and x-rays, checking for signs of arthritis. This dog could potentially undergo non-surgical management. Now, there's not a lot of weight to be lost in this example, so that's concerning. But there may be stuff like no longer letting her jump off of the back porch, no longer letting her run up and down the stairs in the house as many times as she wants, no longer running the back fence chasing dogs walking by, no longer jumping up at the front windows when the mailman comes, and dial all of that explosive activity back and begin slow, controlled, routine leash walks after a period of rest and maybe anti-inflammatories. Okay, it's important to know that if your dog is on anti-inflammatories, they should be rested. They're going to feel great as soon as you start those medications. Do not let them go and run again. So this patient may do well and never have another episode. I think that likely the rehab will take 6 months to a year to prevent this from progressing. And so that takes an enormous amount of dedication. It is very important, therefore, that we recheck this patient. If you just go away and never come back and watch your dog suffer through it, the next set of x-rays is going to look like this set of x-rays on the right. Okay? You can see the progression here. These are x-rays of a dog who has had this injury for about 4 to 5 months untreated. The bone has begun to even change its shape because the tibia is spending so much time in a forward position. Remember we talked about that the tibia moves forward and the femur moves backwards. The tibia has spent so much time in a forward location, it's now beginning to get a shelf of new bone off of the back. The arthritis is terrible. You can see all this is moth-eaten in appearance. There's effusion in the joint. And now we've got severe muscle atrophy, severe arthritis, decreased range of motion. This partial tear may have progressed to a complete tear, and the meniscus is injured, okay? Here's an example of a reason why not to wait. These images are courtesy of Dr. Don Holst, great surgeon, professor that we had at Texas A&M University, and we love Dr. Don Holst. Okay, so here is a really nice set of images. Okay, first we have a knee with joint effusion, some early arthritis here at the tip of the kneecap or the patella. We got a red line indicating the tibial plateau angle or the slope of the tibia. We talked about that in a previous video. That's why the tibia moves forward when the ACL is torn. And this dog with an early partial tear, you can see this is an intraoperative view taken with arthroscopy of a few of the ACL fibers torn. The majority of the ACL is intact. You can see these beautiful lines here. They're intact. these fibers are torn. Okay, this is inside of the dog's knee. This is a little metal probe that's used to probe the ACL. This is the femur, part of the femur here. And so we've got a tiny camera in this dog's joint, an early partial tear. Okay, the decision was made to go ahead and perform a TPLO in this case. So we'll talk about this in another video, but for now, just try and hang in there with me. The bone was cut with a curved saw. A bone plate was applied, and now the new angle is much flatter. So this bone, this top piece of bone that was cut of the tibia, was rotated, and this green line represents the new tibial plateau angle. So the red line was steep, the green line is relatively flat. Dr. Don Holst then went back and looked in this dog's knee, and many of those torn fibers had developed new blood vessels and begun healing. This is because the TPLO procedure takes stress off of the ACL. Okay, so this dog is likely to do much better than one who progresses to a complete tear and never gets surgery, or if they progress to a complete tear, injure their meniscus, and then have a TPLO, they're worse off than possibly a dog who undergoes surgery when it's a partial tear and gets some healing of that ligament. Okay, well, patient size. So the patient's size may be a huge indicator of whether or not non-surgical management will be successful. It is pretty well accepted that the larger the dog gets, the less likely they are to do well without surgery. A cutoff that we commonly use is 30 pounds. 30 pounds, there's some historical literature that looked at dogs weighing less than 30 pounds and said that perhaps they do better without surgery. I still think a lot of them can benefit from surgery depending on how unstable their knee is. But in general, 30 pounds is a nice number we use. The heavier they get, the more likely they are to need surgical intervention. I think we're right back here. So I just finished saying that there was some historical evidence. There was some historical evidence to support dogs less than 30 pounds possibly doing better with non-surgical management than dogs over 30 pounds. And certainly as dogs weigh more and more, the need for surgery becomes greater. All right, so that concludes step number 4. We basically talked about non-surgical management. Step number 5, we'll get more into surgical management and specifically the TPLO. From there you can hang on and figure out why we say that when we talk about scientific evidence. Thank you so much.